Hello everyone, in today's video lecture we will be going to discuss the different types of coronary arteries and the areas of the cardiac muscle which are supplied by these coronary arteries. So guys, as you all know that coronary arteries penetrate the cardiac muscle and supply the cardiac muscle with oxygenated blood. So guys, there are two main coronary arteries. One is the right coronary artery or RCA. The other one is the left coronary artery or LCA. Both of these main coronary arteries arise from the aorta. So guys, over here we can see that this is the aorta, and on the right side of the aorta arises the right coronary artery, and on the left side of the aorta arises the left coronary artery. Okay guys, let's talk about the right coronary artery. So the right coronary artery runs in the right atrioventricular sulcus. And guys, what is meant by the right atrioventricular sulcus? It is basically a groove on the right side between the right atrium and the right ventricle. So in the right atrioventricular sulcus runs the right coronary artery, and through its course the right coronary artery gives several branches. For example, this one, which is the sinoatrial nodal branch that supplies blood to the sinoatrial node, and also this one on the right inferior surface of the heart, or we can say on the inferior surface of the right ventricle. This branch of the right coronary artery is known as the acute or right marginal artery. Guys, after giving these branches, the right coronary artery runs posteriorly. So the arteries on the posterior surface are shown by the broken lines. So guys, these are the arteries on the posterior surface. So as we can see that the right coronary artery runs on the posterior surface, and in 85% of the individuals, the right coronary artery gives rise to the posterior descending artery or PDA. So guys, this one is the PDA or posterior descending artery coming off from the right coronary artery in 85% of the individuals. And you should know that the posterior descending artery runs in the posterior interventricular sulcus. Guys, what is the posterior interventricular sulcus? It's again a groove that is between the right ventricle and the left ventricle on the posterior surface of the heart. So guys, we can say that this is the groove on the posterior surface of the heart between the right ventricle and the left ventricle, along which the PD runs. This is the posterior interventricular sulcus. So this is all about the right coronary artery. Let's move on to the left coronary artery. So guys, the left coronary artery arises from the aorta on the left side and branches into two arteries. One is the left anterior descending artery or LAD. So guys, this is the left anterior descending artery or LAD, which runs anteriorly in the anterior interventricular groove or anterior interventricular sulcus. So guys, the LAD runs in a sulcus or groove which is between the right ventricle and the left ventricle, but this time on the anterior side. So guys, LAD runs in the anterior interventricular sulcus and the PDA runs in the posterior interventricular sulcus. Okay. The other branch of the left coronary artery is the left circumflex artery or LCX. Guys, the LCX or left circumflex artery runs in the left atrioventricular sulcus. So guys, this is the LCX or the left circumflex artery, and this artery runs in the groove between the left atrium and the left ventricle. This groove is known as the left atrioventricular sulcus. Guys, the LCX then runs posteriorly. It's known as the circumflex artery, left circumflex artery, because it takes a turn. The circumflex comes from the word circumference. It takes a turn. It's kind of circular. It has a circular course, so it goes posteriorly. And as it goes posteriorly, it can give rise to the posterior descending artery in 8% of the individuals. So guys, in 8% of the population or in 8% of the individuals, the left circumflex artery can give rise to the posterior descending artery. The LCX also gives another branch which is known as the obtuse marginal artery or the left marginal artery. This artery also runs, initially it runs anteriorly, and then it also takes a turn and runs onto the posterior surface. Okay, so guys, as we talked about the posterior descending artery, you should know that in 85% of the population, the PDA or posterior descending artery arises from the right coronary artery, and these people are known as the right dominant individuals. Okay, in 8% of the population, the PDA arises from the left circumflex artery or the LCX, and these individuals are known as the left dominant individuals. Guys, in 7% of the population, the PDA or posterior descending artery arises from both the right coronary artery and the left circumflex artery, and these individuals are known as the co-dominant individuals. Okay, let's discuss the arteries which are most commonly occluded. As you all know that coronary arteries can get occluded by atherosclerosis and thrombus formation. So guys, the most commonly occluded artery is the LAD, then comes the RCA, and then comes the LCX. Okay, now let's move on to a little bit detail. Guys, actually the coronary arteries arise from the aortic sinuses. Let me give you the introduction of the aortic sinuses. So what are aortic sinuses? Aortic sinuses are basically the dilatations between the wall of the aorta and the cusps of the aortic valve. So guys, these green flaps are the cusps or the flaps of the aortic valve, and the red one is the wall of the aorta. So guys, between the wall and the cusps, there are dilatations. For example, there's a dilatation at this point, and also at this point, and also at this point. So these dilatations are known as the aortic sinuses. Actually, the coronary arteries arise from the aortic sinuses. Coronary arteries do not arise from all the aortic sinuses. The coronary arteries arise from two aortic sinuses because there are two main coronary arteries. So guys, there's a one aortic sinus between the right cusp of the aortic valve and the aortic wall. So between the right cusp of the aortic valve and the aortic wall, there's a aortic sinus known as the right aortic sinus through which the RCA arises, and we can see this opening to the RCA, which is known as the right coronary ostium. Okay guys, if we talk about the LCA or the left coronary artery, so there is a aortic sinus or dilatation between the left cusp of the aortic valve and the aortic wall, and from this aortic sinus, that is known as the left aortic sinus, arises the LCA, and we can see the opening or ostium of the left coronary artery. Okay, so guys, what happens during diastole or during diastole is that there's a backflow of the blood. During diastole, the aortic pressure, the pressure in the aorta rises above that of the left ventricle, or we can say that the blood pressure in the left ventricle falls. So the blood tries to backflow and the valve closes. So as the blood tries to backflow, this is the superior surface, this is the superior side, and this is the inferior side. Normally the blood is ejected from the left ventricle into the aorta this way. So when the blood backflows, what happens is that these valve pockets, they fill with blood, and because these valve pockets fill with blood, a lot of blood is rushed into the coronary arteries via the openings to the coronary arteries. So guys, always remember that during early diastole, there is backflow of the blood which fills the valve pockets or valve cusps, and this causes the blood to rush into the coronary arteries. So the coronary blood flow is at the peak in the early diastole. We can read in the text, during early diastole, the backflow of the blood fills the valve pockets of the aortic valve. This causes coronary blood flow to reach its peak. Okay guys, we can see the same concepts in this diagram as well that we just discussed, that we can see that this is the right coronary artery which is arising from the right aortic sinus, and it gives rise to sinoatrial nodal branches. It also gives to, it also gives rise to the right or acute marginal artery anteriorly. The right coronary artery then runs posteriorly and gives rise to the posterior descending artery in 85% of the individuals. The posterior descending artery gives off septal branches which supply the interventricular septum of the heart. Then there's a left coronary artery which gives a branch which is known as LAD, or left anterior descending artery, that is anteriorly, and LAD has diagonal branches which supply the anterior wall of the left ventricle, and the LAD, or left anterior descending artery, has septal branches which supplies the interventricular septum. Posteriorly, the LCA gives rise to the LCX, or we can say that left coronary artery gives rise to LCX, which is a branch of the left coronary artery, and the left coronary artery branches to form the LCX, and LCX then runs posteriorly, right? And the LCX also gives rise to a branch which is known as left or obtuse marginal artery. Okay, now let's move on to the coronary artery territories, or the areas of the heart muscle supplied by the different coronary arteries. So guys, over here I have shown a diagram in which different areas of the heart are shaded. So guys, if we talk about RCA, so the region of the RCA, or the territory of RCA, is highlighted by the green color. You all should know that the RCA, or right coronary artery, supplies the right atrium as shown in the diagram. It supplies the anterior wall of the right ventricle shown in the diagram. And guys, as we mentioned before, that the RCA gives rise to sinoatrial nodal branches, SAN branches, or sinoatrial nodal branches. So RCA supplies the sinoatrial node. And as you all know that RCA comes off from the aorta, and the SA nodal branches always come out of the RCA. So the blood supply to the sinoatrial node is independent of the dominance. If a person is right dominant or left dominant or co-dominant, the sinoatrial nodal branches will always come from the RCA. So the blood supply to the sinoatrial node is independent of the dominance. Okay guys, if we talk about the acute or right marginal artery, it is a branch of right coronary artery, and the region supplied by the right marginal artery or acute marginal artery is shown with the purple. Okay guys, so if we talk about the right marginal artery or acute marginal artery, it supplies the inferior wall of the right ventricle, and it also supplies the part of the apex. Okay guys, the area of the heart, or the region of the heart supplied by the left anterior descending artery, or LAD, is highlighted with the orange color. So guys, you all should know that the left anterior descending artery, or LAD, supplies the anterior 2/3 of the interventricular septum and the apex. Guys, we can see that the LAD is supplying the apex, and you should know that the LAD supplies the anterior 2/3 of the interventricular septum. As we all know that there is a septum between the right ventricle and the left ventricle, which is known as the interventricular septum. So guys, the anterior 2/3 of the septum is supplied by the LAD, or left anterior descending artery. Guys, the left anterior descending artery, or LAD, also supplies the anterior wall of the left ventricle, and it also supplies the anterolateral papillary muscle. So what is meant by anterolateral papillary muscle? If we talk about the papillary muscles in the left ventricle, so guys, there are two papillary muscles in the left ventricle. One is this one, which is known as the anterolateral papillary muscle. So this is supplied by the LAD, or left anterior descending artery. The other one is the posterior-medial papillary muscle, and this is supplied by the This is supplied by the posterior descending artery or PDA. We will discuss it in a while. Okay guys, right. If we talk about the LCX or the left circumflex artery, so guys, the region supplied by the region of the heart or the area of the heart supplied by the left circumflex artery is highlighted with yellow. And you should know that the LCX supplies the left atrium and the 1/3 of the posterior walls of the ventricles. Guys, what is meant by that? For that, we need to discuss the posterior surface of the heart. So guys, if we talk about the posterior surface of the heart, this is the posterior surface. We can see that the yellow region is supplied by the left circumflex artery or LCX. And as I just mentioned that LCX supplies the left atrium, but it also supplies the 1/3 of the posterior wall of the ventricles. So guys, this is the posterior wall of the ventricles. Let me highlight it with a different pen so that you can understand. Let's choose the pink one. So guys, this is the posterior wall of the ventricles, both the right and the left ventricles. So if we talk about the LCX, it supplies the 1/3 of the posterior wall of the ventricles. The other 2/3 is supplied by the posterior descending artery, and the region of the heart supplied by the PDA is shown by the blue color. So guys, we can see that PDA runs posteriorly and supplies the posterior area of the heart. So let's see the territories of the PDA or the posterior descending artery. Guys, the posterior descending artery supplies the 2/3 of the posterior wall of the ventricles, as we just discussed. So the 2/3 of the posterior surface of the ventricles is supplied by the PDA, and the PDA also supplies the posterior 1/3 of the interventricular septum. Guys, we just discussed that the anterior 2/3 of the interventricular septum was supplied by the LED. So the posterior 1/3 of the interventricular septum is supplied by the PDA or the posterior descending artery. Guys, the most important thing that you need to note about PDA is that posterior descending artery or PDA supplies the AV node, and because the PDA can arise from RCA or LCX or both, so the blood supply to the atrioventricular node is dependent on the dominance, right? And as I mentioned earlier, that the PDA supplies the posterior medial papillary muscle. This one that we discussed, that this is the posterior medial papillary muscle. This is supplied by the PDA. Okay guys, so this is all about the lecture. I hope you like it. If you have any queries, do let me know. Thanks for watching. See you all. Goodbye. Allah Hafiz everyone.